At its peak, fentanyl was killing 200 Americans every day. Now, the numbers have dropped. Recent US health data show fentanyl overdose deaths fell almost 20% last year. President Donald Trump has made fentanyl the justification for tariffs, executive orders, and strikes on alleged drug boats. So, are his tactics working? We reached out to Vanda Felbab-Brown at the US think tank, the Brookings Institution. She's an expert on this crisis and thinks Trump's fentanyl policies, far from helping, are actually a cause for concern.
We are running a very dangerous experiment, which is, are we going to see drug overdose deaths going up?
But first, let's rewind. America's opioid epidemic started in the 1990s with prescription painkillers. And by the time fentanyl began arriving from Chinese suppliers around 2013, millions of Americans were already hooked. And dealers overtook doctors as the main suppliers. So how did so much fentanyl get from China to the streets of US cities?
When fentanyl first starts entering the US market, it is shipped directly from Chinese supplier networks, many of whom are small, family-run brokers, mom and pop type of actors, all the way to the user or to dealers through postal services, regular Chinese post, US post companies like FedEx. That the Mexican cartels are dominating US wholesale drug market for many decades, and they are watching Chinese suppliers taking away their their customers. And so they make the decision around 2015, 2016 to also enter fentanyl. And this is the Sinaloa cartel and Cartel de Jalisco Nueva Generación. They sell it to wholesale operatives of theirs or hand it over to their wholesale operatives, people who belong to the Sinaloa cartel or Cartel de Jalisco Nueva Generación at the city level in a place like Chicago or Baltimore or San Francisco.
By this time, fentanyl had become the #1 drug responsible for overdose deaths, and it was affecting communities across the US.
Now, those are massive numbers with just about 1 in 8 Americans knowing someone who dies of fentanyl overdose, and all sectors, all races or ethnic groups becoming affected, and also a wide segment of age groups.
Trump made the crisis a major feature of his 2024 campaign, promising an aggressive and militarized approach. In office, last year he issued tariffs against Canada, Mexico, and China, blaming them for the flow of fentanyl into the US, although those tariffs have since been struck down in court. In December, he officially designated fentanyl a weapon of mass destruction. That enabled the military to take action against alleged traffickers. So, can Trump take credit for the drop in drug deaths? Here's what the numbers show. Overall deaths from drug overdoses in the US have fallen dramatically, but this started before Trump returned to office. After a height of about 110,000 deaths in 2023, the numbers dropped by more than a third last year. Synthetic opioids, which include fentanyl, were largely responsible for the boom and the fall. It was the sharpest reversal in 15 years of an epidemic that's killed close to 500,000 Americans. So why did deaths start falling in 2023? Researchers point to 4 general reasons. The most commonly cited story is that China cracked down on fentanyl precursor drugs. Mexican cartels couldn't make as much, and fewer Americans died.
By 2018, US diplomacy leads China to schedule the entire class of fentanyl-type drugs. That regulation goes into effect on May 1st, 2019. And when that happens, Chinese suppliers stop sending finished fentanyl to the US, and instead they switch to sending precursor chemicals to Mexican cartels, which then continue cooking fentanyl and bring it across the US land border from Mexico to the United States.
Then in the early 2020s, something else changed in China. The Chinese government began announcing the shutdown of online platforms where traffickers offered precursor drugs and also began publishing more drug seizures. But that's not the full story.
One argument centers on changes in supply that argue that China turned off the supply of precursors in around 2023. I find that argument unpersuasive. If one looks at seizures of precursor chemicals by China, their peak levels are actually in the year 2000. At the time, China seizes more than 2,000 tons of precursor chemicals. Then in 2021, this number goes down. In 2022, it's the lowest number, about 600 metric tons. In 23, it goes up to 9,000. And then in 2024, the seizure levels are around 1,400 metric tons.
So Chinese seizures were higher in 2020 than they were in 2024. Whatever Beijing was doing in mid-2023, when American deaths actually started falling, it wasn't only because of a sudden crackdown on fentanyl chemicals. So what else was happening? Vanda Felbab-Brown has a second theory.
And that is that the Mexican cartels themselves made the decision to be sending less potent fentanyl. I think that's quite possible. There is, once again, all kinds of anecdotal evidence. U.S. pressure on the Sinaloa cartel, on the Chapitos, one of the leaders of the Sinaloa cartel, quite possibly led to them instructing their cooks to be sending less potent fentanyl, leading to less overdose and the response from U.S. pressure. The United States now has several leaders of the Sinaloa cartel under lock and key. They will be heading to trial, and I hope that interrogators, as part of the plea bargains that are being offered as part of the trial, are asking them, did you send less potent fentanyl? Did you make the decision? That would be a real validation of the effectiveness of U.S. law enforcement in 23 and 24. But we don't know whether that has happened.
Now, while it's possible cartels were changing their habits, Vanda Felbab-Brown says there are signs that fentanyl users also found ways to make their doses less lethal.
Fentanyl is so dangerous because it's extremely potent. So it gives very intense highs, far higher than heroin. It is also, however, a drug that very rapidly dissipates in the system. So the high is very, very intense, but it dissipates quickly. And that means that users crave another high very quickly. Users will often crave to use fentanyl, say, 5 times a day. Now, each time they use fentanyl, they risk overdosing and dying. These days, we are seeing all kinds of veterinary tranquilizers also being mixed either into fentanyl or being used in addition to fentanyl, like xylazine, that creates massive health challenges as well, but it often reduces the frequency of use from, say, 5 times a day to 2 times a day, and thus it reduces the Russian roulette of will you die or not with each use per day, at least in frequency. So xylazine, for example, reduces the need to use fentanyl so frequently, but causes very high morbidity, including high necrotic tissues. And so that leads to amputations. And in some places, you see really vast numbers of people with amputations of legs, of arms, which would be one of the consequences of extended xylazine use. It's also possible that users who were most vulnerable have died, and other users have learned how to dose it.
But there's another explanation, a plainer one: old-fashioned prevention and treatment.
You have another group of people that would argue that improvements of policies in the United States and in Canada, which has its own separate fentanyl market, reduced that overdose, that access to treatment expanded, access to overdose medications such as naloxone expanded, access to mental health expanded, both in availability of providers as well as in availability of insurance coverage that allows patients, chronic drug users, to access those services.
And most of these 4 factors that researchers say have tamed the fentanyl epidemic began not under Trump, but his predecessor, Joe Biden.
So the Biden administration in its last year and a half became effective in generating pressure on the Chinese government to restart cooperation. And so finally, in 23, the Biden administration builds up effective leverage against China, and both powers find strategic reason to reduce tension. And we have cooperation going on. Now, the Trump administration comes in January 2025 with guns blazing. It disregards and dismisses the cooperation with China that took place in 24. And it imposes these high tariffs on China, Mexico, and Canada. The Chinese government quickly imposes its counter tariffs. It restricts access to rare earths, such as those needed in the automotive industry. It starts boycotting specific politically sensitive goods, such as soybeans. And at the end of this bargaining, in October 2025, the Chinese government puts on the table exactly the same deliverables on fentanyl that it had already promised the U.S. in July and September 2024. So China gets to double count with two different administrations, the same type of deliverables. And the Trump administration could have avoided that if it did its homework, if it didn't simply dismiss all the cooperation that was going on in 2024 and push forward.
And meanwhile, the Trump administration was pulling apart the public health plan at home. Among the cuts was funding for test strips that were used to check drugs for contamination. These were critical tools the government had actually backed as recently as July.
Now, the Trump administration has radically changed its approach. It limited access to treatment very substantially. So when it came to office over the past year and a half, it's been unwinding a lot of the policies that started in 24. It has reduced funding for treatment dramatically. It has defunded funding for harm reduction, such as drug testing. It's resurrected many obstacles to insurance coverage. And so we are running a very dangerous experiment, which is, are we going to see drug overdose deaths going up?
A dangerous experiment. So what happens next?
Well, I think that the mixture of policies needed. That includes both robust access to treatment and robust access to reversing and preventing overdose, as well as smart supply-side measures. We are running this big gamble. The Trump administration has eliminated access to treatment for many. It has defunded treatment. It has made it far more complicated to access a variety of services that were widely believed to be important factors in bringing the deaths down. And so will the death reductions hold despite those dramatic and, in my view, highly counterproductive actions by the Trump administration? But even if they hold, 70,000 Americans dead is not an acceptable number.
Fentanyl death numbers are down from their peak, but still tragically high. The reasons are complex, and now Trump is changing tactics and cutting health services. It's a gamble that only pays off if you know what's been saving lives. Does Trump know? Thanks for watching.